Hello, my name is Karen. I'm an exercise physiologist with Atrium Health's Cardiac Rehab, and today we're going to talk about coronary artery disease and what are risk factors that put you at a higher risk of developing coronary artery disease. So coronary artery disease or heart disease is a disease where plaque builds up in your coronary arteries and reduces blood flow to your heart. And if that develops further, that puts you at a higher risk of having a heart attack. So it's important to be aware of what type of things cause this to happen, because it's a disease that is chronic. It happens over time. These things that lead up to it are things that are habits in our life that can lead over time to that plaque to build up in your coronary arteries. So healthy arteries should be smooth and elastic, allowing blood to flow easily through them to all parts of the body. And cardiovascular disease occurs when the normally smooth arteries are damaged and blood flow is restricted. Okay, so a risk factor is something that increases a person's chance of developing coronary artery disease, which is the #1 leading cause of death in the United States. So we're going to talk about these risk factors. So we'll start with the ones that you can control with your lifestyle. So the first one is sedentary lifestyle. So if you don't exercise and you sit all day long, that can put you at a higher risk of developing heart disease. So it's important that you are getting some regular exercise in, especially if you have a job where you sit all day. That you're getting up and you're doing some walking and some exercise. So sedentary lifestyle is one. Another one is being overweight or obese. So if you are overweight or obese, your heart has to work harder to kind of pump blood throughout your body and to kind of get you up and going. And it just puts more stress on your heart the more extra weight you have. So that's a second risk factor. A third one is diabetes. So diabetes occurs when the pancreas does not produce enough insulin, or your body cannot use the insulin properly. So if you are a diabetic, that is a risk factor for heart disease. Another one is if you have high cholesterol, so cholesterol, that plaque buildup, especially if you have a high LDL. So the LDL is your lousy, your bad cholesterol, and the HDL is your good, healthy cholesterol. A number to remember is you want your total cholesterol under 200. All right, and then, again, cholesterol is that fatty, waxy-like substance found in the blood. So if it's too high, that can lead to that plaque to form in your coronary arteries. Another risk factor is hypertension or high blood pressure. So high blood pressure is sometimes a clue that, something's not working quite right and your heart has to work harder to pump that blood throughout your body. So it's important that you monitor your blood pressure and talk with your primary care physician about blood pressure and making sure you're aware of what yours is and how you can manage that. Another risk factor, this is a big one, is smoking. So nicotine in cigarettes narrows the blood vessels and can cause an increase in blood pressure and heart rate. All right, so smoking is a big one, and that is the biggest risk factor for a sudden cardiac death episode. So it's kind of a scary one that is really important that you're not smoking, and if you are, you're working towards quitting, setting a quit date and working towards that. Another risk factor is stress and tension. So stress causes the release of adrenaline, which speeds up your heart rate and narrows your blood vessels and increases your blood pressure. So again, it just makes your heart work harder. You're kind of in that fight or flight mode, and you're putting extra stress on your body. So a lot of these things are putting more stress on your body and making it work harder to function and to do your day-to-day activities, and all of that just puts extra stress on that heart, which can make it weaker and lead to that plaque buildup. So those are all the risk factors that you can control with lifestyle. And there's two other risk factors that you cannot control, and that is your age and your family history. So age, if you're a male above 45 or a female above 55, that just puts you at a higher risk of having some coronary artery disease. Another one is family history. If you have somebody in your immediate family, a parent or a grandparent or a brother or sister that has developed heart disease at a younger age in their 40s or 50s, then you're just at a higher risk, and that's just genetics. So that's something you can't control. But it is important to be aware that if you have 3 or more of these risk factors, then that puts you at a high risk category of having coronary artery disease or potentially having a heart attack. So, again, we'll go through them. Age, that one you can't control. Family history, that one you can't control. So especially if you have those, it's really important that you're, doing everything you can to prevent the other risk factors. So, the third one is sedentary lifestyle. So make sure you're doing what you can to get more active throughout the day and getting more active minutes and steps in. Weight. So if you're overweight or obese, that is a risk factor. If you have diabetes, that one is a risk factor. High cholesterol. Again, you want it to be under 200 total. If you have high blood pressure, hypertension, if you are smoking, okay? And then finally, if you're under a lot of stress. So kind of check them off, how many of those do you have and what can you do to kind of prevent that? It's changing your diet to something healthier, making sure you're monitoring your blood pressure and cholesterol and working with your doctor, you're getting your exercise in, maybe just pick 1 or 2 of them that sticks out in your head that, okay, I know my cholesterol is pretty high and I'm taking some medicine for it now, but what else can you be doing? Making sure you're staying away from fried foods and watching out for those bad fats. Or, if you are sedentary and you sit at a desk all day, how can you get up and get moving throughout your day to be less sedentary? So just kind of keeping in mind those risk factors. It's important to be aware of them because, if there's something you can do today to prevent you from having a heart attack in the future or 5 years down the road, then you definitely want to be doing that. So I hope you found this helpful and educational, and you take, just one thing to kind of start changing in your life to live a healthier lifestyle. All right, well, reach out to me again if you have any questions. My name is Karen with Cardiac Rehab, and we look forward to sharing more videos. All right, thank you.